Good afternoon, one and all. Thank you for joining us today. I'm Sai Priya from MedWorld Expo. We're a unified digital healthcare platform that connects manufacturers, distributors, and worldwide. While we also bring hospitals, clinics, laboratories, healthcare experts onto one platform. It gives me great pleasure to welcome you all today to today's webinar. It's my privilege to introduce today's esteemed speaker, Dr. M. Mahesh Babu. He's a consultant physiotherapist at Recare and Cure Physiotherapy Clinic and Rehabilitation, with over 3 years of dedicated experience in physiotherapy and rehabilitation. Dr. Mahesh Babu has honored his expertise across diverse specialties, including neuro, orthopedic, and sports physiotherapy. He has worked extensively with patients recovering from major surgeries such as total knee replacement, total hip replacement, hip injuries, and spinal conditions. Today, he will be sharing his insights on the important topic understanding frozen shoulder causes, care and cure, helping us gain deeper understanding of this common yet challenging condition and the ways to manage it effectively. Please join me in welcoming Dr. M. Mahesh Babu. Sir, you may start.
Yeah, this is Dr. Mahesh Babu, physiotherapist. Welcome all in the virtual meeting in the webinar. So I am going to speak about shoulder joint. Nowadays, everyone is facing that major impact of the joint pain. So it is made up of three bones: the clavicle bone, scapular, and humerus bones. The glenohumeral joint. It is also a ball socket and joint. So majorly, the joint made up of with three bones, that is scapular, clavicle, and humerus bones. These are the main impact of the strength giving to the shoulder joint. The movements is majorly impact in the joint. Those are internal rotation, external rotation, and flexion, extension, adduction, abduction, and circumduction. So these are the major movements of the shoulder joint. And then rotatory cuff muscles are using to mobilize the shoulder joint for the major muscles of that shoulder joint. Subscapularis, supraspinatus, infraspinatus, and teres minor. These muscles are cuff muscles for using of rotatory of the shoulder joint. And these muscles are very impact for useful for shoulder movement, for rotation. Primary ligaments, that stabilize the shoulder, that's primary ligaments are superior glenohumeral ligament and middle glenohumeral ligament and inferior glenohumeral ligament. And both are using for same the methodologically using that shoulder joint for the movement of the healthy movement for that shoulder joint and in strengthy giving some strength for getting any type of weights lifting and this piece of so pain-free movement for that shoulder joint. And then now coracohumeral ligament and capsule. These both are adding to lift the shoulder joint for making some clear the shoulder joint for pain-free. And then common peripheral nerve injuries also making the shoulder joint impact for pain and inflammation. Those are axillary and circumflex nerve injuries. And these are uh, giving some test by gaining the pain in shoulder joint. That nerve reflection test also done for what is the major issue in the shoulder joint for not able to move that rotation or mobilize the shoulder joint. Common causes for anterior dislocation and acute injuries to anterior humerus and subscapular nerve injuries and posterior shoulder injuries and hyperstretching musculocutaneous nerve humeral dislocation of fracture. So frozen shoulder, it is also called adhesive capsulitis and periarthritis. So with frozen shoulder is a clinically syndrome with painful restriction of both active and passive shoulder movements, particularly exact causes is unknown. It can be aggravated by diabetes mellitus and hypothyroidism, reflex sympathetic dystrophy, cervical spondylosis, and hypothyroidism. And cervical spondylitis also can cause for frozen shoulder. So, clinical presentation is it is involves stiffness and pain. It limits the movement. The movement restrictions happened in the shoulder joint. So, majorly, movement restriction is flexion, unable to flex the shoulder joint for 45 degrees to 60 degrees. So individual person cannot lift that shoulder or arms to 0 to 45 degrees. So unable to lift the shoulder. So and then lateral rotation also cannot mobilize the shoulder joint, and flexion, lateral rotation, medial rotation, adduction, circumduction. These are the major movements for shoulder joint. The causes, it is a result of capsular adhesions and resulting in inflammation shoulder capsule. So these are the major impact for shoulder joint to unable to move. So majorly the impacts more than 45 years old people. Uh, so its effects in there that age group. So it is a result of capsular adhesions. In stages, it has some stages. Three stages of frozen shoulder has in the medical propaganda. So the first one is the freezing stage. The freezing stage is any movement of causes pain. So second one is frozen stage. The can't able to perform any movements. So any some of people are going to any gymnasium, so and then doing some exercises or in a daily activities in their life. So they are unable to move or unable to move and unable to perform their activities in daily life. So the frozen stage is can't able to perform any movements. So the third one is thawing stage. Shoulders ability to move begin to improve. So after the getting the treatment or any giving some rest to the joint, they can able to move in little bit. So after the decrease of the pain or inflammation. So majorly, it has some risk factors. Age will impact above 45 years in before we have discussed. So the rotatory cuff injury, broken arm, surgery, post surgeries. So these are the major risk factors in frozen shoulder. So these kind of people cannot move their shoulder in spite of knowing that same the severity of shoulder inflammation or injury, the pain. It is very impacts to the patient region and the in the shoulder region. So it has some treatment. So first of all, we have to go for diagnosis pattern. The diagnosis pattern is we have to get some X-ray of shoulder joint due to getting that problem of shoulder joint. So after getting that X-ray, so we confirm we diagnose the shoulder joint where that shoulder is making some stiffness and the making inflammation or pain. So after the diagnosis, we conclude that problem. So the conclusion of after conclusion, we have to go through treatment. So treatment is injection, some kind of modern treatment we have in the society. So some people are getting some type of injections like steroids in the shoulder joint. So in the injection is hydrocortisone like steroids. It reduces the pain and reduce the inflammation. So we have to prevent the capsulitis, the inflammation capsulitis of shoulder joint. So presentation in the shoulder joint, that pain will reduce after getting the intra-articular injection. So the patient will feel the pain free in a movement of rotations and abductions, flexion, extension. These kind of movements he will do after that getting that injection. So prevention in the frozen shoulder, primary capsulitis. So extreme stretch stored back and pain is generated. Continuous exercise should be done. secondary capsulitis is ROM. So range of motion is restricted. So should avoid excessive weightlifting, avoid stretching, and high resisted movements and jerks and shocks, movements of shoulder. So restoration and physiotherapy. Actually, the motto of physiotherapy: the regain, restoration, re-strength, and refunction. So this physiotherapy will impact in frozen shoulder. The who is suffering from frozen shoulder, he will get better experience and better relief from the acute pain and moderate pain. Okay, then restoration of and physiotherapy reduce the pain, improve shoulder mobilization and mobility, and passive mobilization, relaxation, and stretching and strengthening and heating. These kind of physiotherapy exercise, and we have to use. We also use modalities in the frozen shoulder therapy. So it will take some time to reduce the pain and inflammation in the shoulder joint. So uh, uh, so nowadays, and each and every human being is facing in the daily life, they are sitting a long period of in the office chair or anywhere else. So they are not mobilizing their limbs, the upper limbs and lower limbs. They have to mobilize their limbs in every time. They have to take some time to mobilize the every limbs, because the limbs have to move, because of the limbs have some kind of stiffness. They feel stiffness in the limbs. So some time they have to give mobilize and shoulders and every each and every joint they have to mobilize in every day their life. Uh, Thank you.
Sir, we have questions in chat box. I'll read it out for you. You can just answer those questions.
Okay.
Sir, so what are the most common causes of a frozen shoulder and who is more likely to develop it?
Actually, the causes of frozen shoulder,
Yeah.
the majorly age is very impact in frozen shoulder. More than 45 years old, they will get some. They are obese, or they unable to move. They are not activity. They are not doing activity in daily life. So that frozen shoulder will impact and freeze or frozen. So then the next thing is diabetic mellitus. The diabetic mellitus that people also can't able to sense in the limbs. So more than they have to maintain the diabetic and fasting post lunch. This kind of investigation will do. So after getting that investigations, they have to maintain the diabetes, and nutrition is also major impact in the shoulder joint, that frozen shoulder reduction of the pain. So majorly in hypothyroidism patients also they will get the same frozen shoulder, and in females, uh, females also they are gaining the weight, so that weight impacts the hypothyroidism. Hypothyroid patients also they'll get frozen shoulder.
Okay, sir. So the next question is, are there any early warning signs that people should look out for before it gets worse? Like, what are the early signs in it?
Early signs. Early signs is
Yes, sir.
majorly in trauma, or they sleep one side. One side they give some very criticized pressure on the joints. The ligaments mainly injured or unstable at the shoulder joint. So they have to we have discussed that, and they have to daily act. They have to maintain the daily activity in every day. The functional programs they have to do due to but they have to make some time with them period of making some exercise for limbs. So after the getting of the resolution in the joints and restoration in the joints, so the awareness they have to follow the some medical invasive programs, and they have to consult the nearby physiotherapist when they are getting the pain in the shoulder. They don't wait for the medications. So NSIDs can't be used in prolongation. in the shoulder joint. So some of people are using the NSAIDs medications in prolonged problem. So they will get the another issues in their life. So they have to concise that problem where they are getting when they are getting the issue in the shoulder joint. So after that, they have to consult the physiotherapist or orthopedician. They will diagnose the issue and they are suggest the programmation of physiotherapy or medications.
Okay, sir. The next question is from Pooja. How can we differentiate a frozen shoulder from other shoulder conditions like a rotator cuff or injuries in arthritis?
Yeah. So arthritis and periarthritis and adhesive capsulitis. So the difference between frozen shoulder and arthritis. Arthritis frozen shoulder, the shoulder have some inflammation in the capsulitis and they unable to move. The same as like in the arthritis. Arthritis is affected in each and every limb. So frozen shoulder is the at the same place where the pain is triggering in the shoulder joint. That is a different. Hello.
So the next question is, what role do lifestyle factors such as posture, diabetes, or injury history play in causing a frozen shoulder?
So the every day we have to make some we have to make one lineup in our life. So daily, every day in activities and in a very awareness in right in a very awareness in our posture and our work, our physical activities. So each and every person have to move their limb in every day when they are early wake up early in the morning. So they have to mobilize their limbs in each and every limbs for 10 to 15 minutes. So and we have to sense some nutritional effect. So in the high protein and the high protein also makes the joints will impact to unable to move. So and then they have to maintain their weight approximately their height, their age equal to their weight. So also regularly they have to consume sufficient water, sufficient dehydrate. They have to maintain the hydration in their body. So after that, reduce the unwanted medications, reduce unwanted medication consuming. They have to reduce.
Okay, sir. I think the last question we can take up is, can a frozen shoulder heal on its own over time, or its medical intervention is always required?
Frozen shoulder will not. So frozen shoulder is the prolonged problem. So they have to maintain and they have to continuously they have to visit the physiotherapist. The physiotherapist applies some different kind of modalities to reduce and to give some strength to the shoulder joints and ligament functions. And everyday program they are applying for that frozen shoulder reduce the pain and function of the rotations, flexions, some internal rotations, external rotations, abduction. It has some different kind of therapy in frozen shoulder. The frozen shoulder will take to reduce 6 months to 1 year, more than 1 year in the therapy. So they have to maintain that same protocol, therapy protocol in a observation of physiotherapist, and so some exercises, some modalities. So this will help.
Okay, so like we have one last question from Ria. What are the risks and benefits of surgical options in severe case of frozen shoulder? So this is the last question, sir.
Okay. In
Yeah.
frozen shoulder, they feel like stiffness and unable to move. So that time, the physiotherapy after for pre surgery and post surgery, physiotherapy will help. So post surgery, in surgery of frozen shoulder, they they corrects the correction the portion of that shoulder joint. So after that, they have give some corrections in the shoulder joint. So after that, the corrections and giving some strength to the same capsulitis, and like adding some energies like muscles and calf muscles, anterior axillary nerves. These are the corrections in the shoulder joint in orthopedic surgery. So after surgery, the physiotherapist will um, uh, give some more strength to the patient, doing in their life more mobilities and more giving some strengthening mobilizes in the shoulder joint. So risk in the shoulder joint. So unable to in spite of knowing that shoulder issue, shoulder risk, shoulder injury. So they are trying to mobilize shoulder more than stretch, more than giving heavy strength to the stretch. So after the stretch, it will they'll give some risk to giving some dislocations of humerus bone. So that kind of risk will happens.
Okay, sir. Thank you so much for your response for all the questions, sir. Before I close this session, I just wanted to explore, make you show that a complete MedWorld Expo platform, which made this webinar successful. And thank you so much, Mahesh, sir, for giving your first webinar with MedWorld Expo. We are so glad to have you over here. So before
Thank
closing, I just wanted to share my screen and show what exactly the MedWorld Expo is. So I hope you guys can see my screen, right? So can you see my screen, sir? Can you please just check? So, MedWorld Expo is a global healthcare platform which helps manufacturers, distributors to connect directly in our platform. So, it is a complete networking platform. As most of the people who have joined in the session are medical students, doctors, and healthcare professionals. So, I just wanted to show you how MedWorld Expo will benefit for you. So, if you can see my page, if you can see my screen, this is MedWorld Expo landing page, whatever that you're seeing. So if you come to network and if you click on healthcare services, if you explore healthcare services, you will be able to see different types of hospitals, doctors, laboratories, clinics, and all of this where you can explore, you can connect, and you can able to find out any kind of healthcare organization that you're looking for. Apart of that, as a healthcare professional, we have an option called events. In that, you will be able to access webinars. So the way how you have registered for the webinar and you have joined this webinar, in future, we have so many upcoming webinars related to dental, related to cardiology, and related to n number of specialties. So this will help you out to find the right webinar, and it will make you to able to gain knowledge. And the other thing is CME programs, which we are going to start soon. And especially like doctors like Mahesh sir and few of the medical students who wanted to increase the knowledge in the medical field. So this CME program will help you a lot. And this is a credit based program where doctors need to get these kind of credits to renew their license, right? So we are giving these certified programs through our platform. So I hope people who have not registered in MedWorld Expo platform, please do register. www.medworldexpo.com is our platform link. Once you click in, you will be able to create and register an account either as a doctor or a medical healthcare professional, anything it can be, whatever the profession that you are. And we have other options called knowledge session, the news and updates. As day by day the complete sector is going to change, and always the latest technology is going to coming into the world, right? So we are updated with latest news and trends in medical and healthcare sector, so you will be always get access to complete healthcare news and updates. And we have medval blogs. As a medical student, as a doctor, you will be able to write any kind of medical blogs over here. If you wanted to write related to physiotherapy, you can write. If you wanted to write about dental, you can write about it. So whatever that you wanted to share your thoughts, you can write it as a blog, and you can directly showcase to complete healthcare network within the global. So, and we also have the medical communities. since you are into medical field, as if you are a student or if you're a doctor and you wanted to network more, so our platform is the right choice for you to for you to network. So we are giving an opportunity for you as a any specialty guy. If you wanted to join any kind of specialties in medical community, we are here to help you out. You can directly join, or else you can create your own community and make people join. It's not only about the domestic, it's about the globe. So around across the globe, if you are, if you wanted to join with people with around different specialities, we are here to help you out, and our platform is the right choice for you to make network within this global. And we have healthcare journals. If you are interested to write any kind of medical journals or healthcare journals, or if you wanted to browse, so we have medical journals and medical magazines where you will be able to access and you can use it for your knowledge gaining sessions. And we have career advancements, so this is mostly applicable for most of the people who are just graduated or people who are completed their post graduation and looking out for a better opportunities in future. So in the medical sector or in the healthcare sector, people are people are like they plan to go abroad and pursue their studies, right? So we are here to help them out from right from the scratch, like choosing the sector, choosing the college, like choosing applying for visa, which country that you have to select. Our career advancement program will help you out to find the right choice. And the other thing we have is job platform. This job platform will help you out to find the right job opportunities within the healthcare sector. So if you haven't registered to MedWorld Expo, please do register. And thank you so much. That's all about MedWorld Expo. Thank you, Dr. Mahesh sir, for giving your valuable time and efforts. I hope everybody liked the session. Thank you so much, sir. Thank you, everyone. Mahesh sir, do you like to say anything before we end the session?
Uh, no, thank you. Thanks for
Thank you,
giving
sir.
some
Yeah, thank you.
platform for exploring that my knowledge. Thank
Thank
you.
you, sir. Yeah, have a
Yeah,
good day.
yeah, thank you.